Good evening and welcome to tonight's Yuvavani. In this episode, you will listen to Dr. Rakin, junior resident at NIMHANS, Bengaluru, who will deliver a talk about drug addiction in youth and how to combat it.
So tonight we'll be talking about substance abuse, or let us put it in this way, a substance use disorder. Because the term substance abuse carries a lot of stigma associated with it. This is a kind of disorder in which it can be as normal as any kind of disorder like diabetes or any illnesses like hypertension, and can be affected to anybody. It's not that anybody is immune from the same. However, we are seeing that increasingly the youth in our country are getting involved in these cases. First, we need to think, what can a substance be? For example, a substance can be as small as something food. If somebody who is too much addicted to eating a lot of heavy carb foods or something which is quite high in fat, so that can also be termed as an addiction. But where do we go into something so that we can term a particular thing as a disorder? That is a boundary that we need to draw. We can actually term it as a behavioral addiction as well as addiction to particular substances which can be consumed by the person. So under the purview of behavioral addictions, we can have things like gambling or a gaming disorder, which has been increasingly prevalent these days. The thin line draws where a person just understands that this is the limit, this is the thing that gives me pleasure and I have to stop here. But when that line goes away and person goes on to have a loop of using the same kind of thing to get pleasure again and again, it forms a kind of substance use disorder. So apart from this behavior, we can have substances like alcohol, some tobacco products like we can have smoked tobacco in the form of BDs or cigarettes, and we can also have tobacco products which are chewable. That is the chewable tobacco, gutka, khaini, hans, many kind of things. Apart from that, there's a increasing use of cannabis, opioids. We are also having a use of sedatives in the young population. And in the recent years, we can see the energy drinks like the Sting, Hell, or other kind of drinks are also being abused a lot. A lot of youth is actually losing out the energy and time that could have been invested into something meaningful. When we look at the presentation, it could be a harmful use of a substance or a dependence use of a substance. In a harmful way, if we can just look at somebody who is driving vehicle along with use of consumption of alcohol, or a person who knows that he has some respiratory disease like asthma or tuberculosis, still he is using cigarettes and BDs, then this would be a harmful pattern of the use, person knowing that it will cause a problem further. And apart from that, a person can actually go up into dependence of a substance. And when we talk about dependence to something, then we generally tend to have some kind of criteria with respect to the same. If the person had developed a craving for the substance, there's an intense urge to use it, and without using it the person doesn't feel or doesn't have the go-to throughout the day, then the person can also have features of tolerance to the same. The earlier amount of the substance now doesn't give the same amount of pleasure or even the amount of rest to the body that earlier was being achieved. The use and the pattern of the substance, the procuring of the substance becomes increased. In such a way, the person's time, energy goes wastes into the substance that he is using. Also, there can be withdrawal symptoms with respect to the substance. This develops usually over a course of chronic use of the substance, and when the person stops using the substance, then he develops some kind of features like psychological restlessness, or the person might also have some kind of physiological changes in the body. For example, a person now who was quite addicted to alcohol, when he stops suddenly, might have some kind of tremors in the body, might also have a lot of sweating in the body. Many people are now coming in the stage of harmful use and not going into dependence, so it is easier to treat them. And with respect to the dependence pattern of use, here we have to go into more sort of a pharmacological treatment in which a lot of drugs have to be put in so that we take care of the withdrawal. When we work on the acute period, then in that cases the drugs help us to prevent withdrawal, but in the long run we have to have some amount of therapy with the patient, as well as we need to engage the client in some kind of relapse prevention exercises to prevent the person from having further relapses of the same thing. some people who are more predisposed to this kind of development of the disorder can be who have a genetic risk with respect to the same. Their first degree relatives, that is somebody like their mother, father, or any brothers or sisters, might actually be suffering from a substance use disorder. Then somebody who has had a kind of traumatic events in their childhood, like some kind of unfortunate events like childhood sexual abuse, or some kind of abuse in form of emotional or physical nature when they had been growing up in the childhood. Then later, a person who actually developed a kind of psychiatric illness in their life, for example depression, anxiety, in those cases people generally tend to take the resort of the substance in order to come out of the illness that they are having. Although it in the long run it goes into the vein, but actually that sets the path of dependence in the person. Then the person can also have some pre-existing vulnerabilities. By vulnerabilities we actually mean that the person is having some kind of predisposition and some kind of what do we say, there's a hole in the glass or a break in the glass that actually might lead to the shattering of the glass later. So these can be some kind of low tolerance to frustration. The person might be overly sensitive to rejection from other people, might be always on the go with respect to thinking about what people are actually thinking about me, having a fear of judgment. And in order to come out from all these things, the people can take the help of the substances, and they can actually go into a form of disorder later in the life. By dependence, what we mean is the body and the mind is actually not able to have a peace without the substance. By this, we can have an urge to use the substance at any point of time. This is called craving. The person, first thing in the morning, might require a drink or might require a smoke. And that is a kind of irresistible urge with respect to the substance. That might be the first sign of dependence in a person. And later on, what happens over the years or over the months, it depends on the person. He or she may develop some kind of tolerance to the substance. Now the usual amount does not give the same kick, so he has to increase the amount that has to be there. And definitely when we are increasing something that is bad towards our health, that will have an implication with respect to the health disaster that he or she may have later. Then the person can have a feature called salience. By this we mean that the person is occupied with respect to use of the substance, coming out of the effects of the substance. Or for example, just there is somebody who drinks too much in the morning. Then in order to come out of that drink, he is using a lot of lemonade, doing a lot of efforts in order to come out of the effects of the substance and go to the work actually. So apart from that, what this salience might lead to is a social withdrawal and a social impairment in the life. So this actually might be a feature in which the person is not able to function well in the society. Also, the person can lose control as to the predetermined quantity or the quality of the substance that he has. Somebody who is drinking beer or somebody who is using a low grade kind of substance might actually go on to experiment into a substance which is much more dangerous. For example, whiskey or some other hard liquors. And now the person might actually lose control over the quantity and quality. And then he keeps on using its substance to a point that he is not able to get up even from the bed. So that counts into the loss of control with respect to the same. So these are some definite criteria of dependence. If we go from the medical terminologies, if a person satisfied any two or even three out of these, then that person can be termed to have a dependence with respect to the substances. If somebody from our family is not returning home for a long period of time, and we are actually seeing that people are telling that they are going to their friend's home, and it's been more than the usual amount of time that they generally spend with their friends or even somebody they know, and they come home and we can see a bloodshot eyes. Also we can actually smell the alcohol or the cigarettes or even the substance like cannabis onto the person very well and very easily. We can actually see the person to be neglecting their academics, not going for the work regularly, taking frequent leaves in order to use the substance. And often there have been recently complaints from against the person. There can be some physical signs that the person is who was earlier quite well now begins to have a tremulousness in his hands. He is always shaky, he is very irritated, very anxious, contrary to the nature that he had. Also he has gone into some kind of financial issues, some kind of debts. So then we have to be bit alert, and the family members can take a call with respect to that. Now we need to have some intervention. And then they can actually go on to a healthcare professional. It can be anybody, your primary physician, your family physician, or even the medical officers in the government colleges or private colleges, whatever you prefer. Also, the specialist care that comes into this thing is from a psychiatrist. Also, if somebody lives in an area where they cannot have a physical contact, then they can actually use the helpline numbers. We have a helpline of Telemanas. The number is 14416. This is not just specific to substance use. This is for any kind of psychological distress that the person has, some kind of suicidal ideas the person might be having. They can actually call this number and communicate, and you will be given enough time and care. With respect to specifically addiction, people can go for this national de-addiction helpline. The number is 1800 11 0031. And just keep in mind, you need not worry about this. You are not alone in all this. There is help available out there, and there are people eagerly waiting to help you. We see a lot of results. Most of the improvements have come from the intrinsic will of the person. When the person is motivated enough to have a preparation with respect to the choice that he wants. Also, with respect to the substances, a lot of relapses and lapses happen, but we need to understand the difference between lapse and a relapse. With respect to lapse, if somebody has a lesser than usual quantity of something, and the person is not having a lot of psychological or physiological dependence onto it, then we consider it to be a lapse. Lapse is a normal kind of thing in the progress towards de-addiction. Then we consider about relapse. In relapse, what we need to understand is when the person has gone off to the usual quantity of the dependence that he had, or actually has exceeded what he was using earlier. This can also be possible, but most of the times we see lapses more than relapses. I have seen that people are not much more aware about the emergencies that this field carries. These can be things like overdose to a particular substance or severe withdrawal to something. And these can range from a kind of opioid overdose, or a overdose of a sedative hypnotic like a benzodiazepine or a sleeping pill. People can abuse it in order to have some kind of relief from emotional stress or something. But we need to understand that this might actually be life threatening, and the person has to be brought to the emergency then and there itself. Also, one thing I would like to share is a condition called delirium tremens. It comes with the use of alcohol. Approximately 5 to 15% of people who use alcohol worldwide tend to develop dependence to the alcohol. And those who develop dependence from those, about 20% more can develop a feature called delirium tremens when there's a severe withdrawal to the alcohol. This generally sets in after 4 or 5 days of not using alcohol continuously. This can happen when somebody is locked up in their own home by the family members that he or she will not consume alcohol anymore. They have had it enough. But if the person is very shaky, if the person is not oriented to time, place, and person, when you go to talk to him, he asks, "Who are you? Where am I? Or what is happening all around?" He seems very confused, very agitated, just opening the door and running away. This can be a sign of delirium. And in that cases, immediate help has to be sought because it has a mortality of 20% associated with it. So this is something that people who care for people who consume alcohol have to consider them in their mind. We see that about 60-70% people actually go on to improve with respect to all the features of their involvement in the work, society, and academics. And it is actually the person's engagement and the person's commitment with respect to the treatment that brings the change. It is not just a job of one person.
In Yuvavani tonight, you were listening to Dr. Rakin, junior resident at NIMHANS, Bengaluru, who delivered a talk about drug addiction in youth and ways to combat it.